Hey chronic care champion, so what do you do when a patient has cold, painful fingers, tight skin, and unexplained shortness of breath? You may be looking at scleroderma, also known as systemic sclerosis. This rare but serious autoimmune disorder affects not just the skin but honestly the entire body. And nurses play a vital role in managing its progression and promoting quality of life. Scleroderma is a chronic autoimmune connective tissue disease marked by excess collagen production. This leads to thickening and hardening of the skin, and in many cases damage to internal organs and blood vessels. There are two main types. First, limited cutaneous systemic sclerosis. Skin changes show up on the face and extremities, and it may develop into Crest syndrome, which stands for calcinosis, Raynaud's, esophageal dysfunction, sclerodactyly, and telangiectasia. Second, diffuse cutaneous systemic sclerosis. This type involves widespread skin thickening and early organ involvement like the lungs, kidneys, and GI tract. So, let's talk about common symptoms and organ involvement. You might see skin tightness, stiffness, and a shiny appearance. Raynaud's phenomenon is also pretty common. It's basically vasospasm of the fingers or toes, triggered by cold or stress. Patients can have dysphagia, reflux, constipation, or diarrhea. Pulmonary fibrosis or pulmonary arterial hypertension can develop, and though it's rare, renal crisis can be life-threatening. Fatigue, joint pain, and functional limitations are also frequent issues. When it comes to treatment and management strategies, there's no cure, so the focus is on symptom control and slowing progression. Medications may include immunosuppressants like mycophenolate mofetil or methotrexate, vasodilators such as nifedipine or sildenafil for Raynaud's or PAH, proton pump inhibitors for GERD, ACE inhibitors for renal protection, and, used cautiously, analgesics and corticosteroids for pain or inflammation. Other strategies include physical and occupational therapy to maintain mobility, skincare regimens to reduce dryness and cracking, and nutritional support for GI involvement or dysphagia. So when it comes to maintaining skin integrity, it's important to apply emollients regularly. Also, be sure to teach patients to avoid trauma, especially to their fingers and toes. For pain and joint stiffness, you'll want to encourage warm baths, gentle stretching, and getting occupational therapy involved. And don't forget to reinforce medication adherence. Now for Raynaud's management, patients should avoid cold exposure and use gloves. Smoking cessation is key, and stress reduction techniques can really help too. For those GI symptoms, recommend small frequent meals, elevating the head of the bed, and of course monitoring weight and nutritional intake. Finally, let's not overlook psychosocial care. Chronic illness can lead to depression, anxiety, and isolation, so it's crucial to provide emotional support and offer referrals to counseling or support groups. Scleroderma is a condition that hardens the body, but through your care, empathy, and education, nurses soften the experience for patients every step of the way. Do you have experience with scleroderma care? Go ahead and share your nursing insights in the comments. And hey, don't forget to like, subscribe, and follow for more autoimmune care breakdowns, because informed nursing really does change lives.